This is Dr. Mohan M R, consultant orthopedic surgeon and also medical director at Nano Hospitals, Bengaluru. Pelvic tilt. Pelvic tilt can be better demonstrated with a graphic. Basically, when you are standing on your two legs, the pelvis is attached to the spine. The entire biomechanics, the weight bearing or the balance is dependent on the entire axial spine, which includes the spine and the pelvis, which is standing on the two legs. There are various forces which can tilt the pelvis into anterior tilt or a posterior tilt. Normal physical forces can also do that. But in chronic conditions, can cause the pelvis to permanently tilt to particular area. Usually it becomes anteriorly tilted. It increases the anterior tilt is increased. Hip also goes for a flexion and the spine will going to be in hyperextension. As I said, the conditions might be neurological conditions which can cause that, traumatic conditions, injuries can cause that, inflammatory condition, arthritis can cause that. Among all the other factors, the most important commonest factor is the obesity or overweight. Can also cause a pelvic tilt, which is the most commonest form for pelvic tilt, apart from all pathological conditions, medical conditions. The overweight or obesity over a period of time, because of the accumulation of the fat around waist, the pelvis will also get tilted anteriorly. When this is tilted anteriorly and the hip is flexed, the efficiency of walking, running or any physical activity will be curtailed, will be limited. Efficiency with which you want to do an exercises will be limited. Of course, the obesity-induced, overweight-induced pelvic tilt can definitely be treated with the proper training and assessment. The assessment is very easy. If you are a clinician or a physiotherapist can definitely diagnose you by a clinical examination what is the alignment. We can do standing scanograms to assess the pelvic tilt. As I said, if it is a particular pathological condition, medical condition causing a pelvic tilt, that has to be addressed by treatment for that particular disease, which can be done with any clinician to differentiate causes of pelvic tilt apart from the regular lack of physical activity or the obesity. If other medical factors are not there, the treatment remains very simple, getting assessed by a clinician or a physiotherapist and doing proper exercises basically to increase the hip mobility and also the mobility of the spine. Once both the upper and the lower mobilities are restored, pelvic tilt can be easily be corrected, but with the exercises itself under guidance of a good therapist. So once if it is other factors, medical related reasons are not there for the pelvic tilt, if it is related to only obesity or lack of exercises, the treatment also is straightforward. One, get assessed by the assessment of the pelvic tilt by a physiotherapist or a clinician or a sports coach who are trained to assess the mobility and the alignment of the axial spine. Once that is done, it is easy. Proper mobility exercises, increasing the mobility of the hip, knee, especially the hamstrings, and then the spinal mobility, the hip tilt can be automatically can be corrected over a period of few months.